Coming up also in the $940 billion health bill is expanded powers for the IRS.
The agency would be able to fine people who choose to not take insurance and could even confiscate those people's tax refunds.
And that has Republican Congressman Peter Roskam of Illinois very concerned. He joins us right now. So what's going to happen? How much more power will the IRS have, and how are they likely to exercise it?
Well, they'll have more power in that they'll have 16,500 additional employees and probably an additional $10 billion over 10 years. So think of the irony of that. Congressman Kevin Brady from Texas pointed out yesterday, he said, look, shouldn't we be creating openings for physicians and nurses, and what we're doing actually is creating positions for IRS agents and auditors? You know, we had testimony before the Ways and Means Committee, and the National Advocate for the IRS, the National Taxpayer Advocate, acknowledged that there's a lot of ambiguity in this health care bill, and I take that to mean that we're going to see expanded IRS powers.
Okay, well, then tell us, Representative, what this would actually mean. Is there anything that you're planning on doing about it?
Well, we're fighting tooth and nail to try and kill this bill, first and foremost. But secondly, within the bill, there's a requirement that health insurance providers send to the IRS the functional equivalent of a 1099, that type of indication that says that the individual has coverage. The IRS is going to be monitoring on a monthly basis whether Americans have that coverage. And if they don't have that coverage, then they're going to be subject to the individual mandates tax, which opens them up to a whole host of things. And if there's a tax refund, sorry, United States taxpayer, you don't get your tax refund because you don't have the type of coverage that Speaker Pelosi says you should have. This is a bad idea. It wholeheartedly needs to be scrapped.
Congressman Peter Roskam, good to see you. Thank you very much for being here.